All right. All right, thank you. It's good to be here again at the boot camp, and I love coming to this and meeting all of you and listening to the doctors, because I'm a philosopher, not a medical doctor. And we have 2 sessions, and it's going to deal with medical ethics and metaphysics of the person. So we'll be able to build on some of the things that happened in the earlier session. You have a handout there in front of you. And I'll refer to it on and off during the lecture. And there's a lot of good quotes in there you can read and think about during the week even if you want to discuss them. So if you see the top of the first page of the handout, I have 4 main topics listed there. The role of the magisterium for Catholic medical professionals, then object, intention, circumstances, and the Hippocratic Oath, the nature and dignity of persons, metaphysics of the person, and then some bioethical principles and applications. The first 2 topics I can do a little bit quickly. So the magisterium, I'm just going to say a couple words about it. It's the teaching office of the church. And I made a chart there. Some of you are probably already very familiar with these documents, okay? The point that I want to make about the magisterium is this, and I'm not an expert on it. There's a book by Avery Dulles called Magisterium. Read that book if you want to know about the magisterium. But the point that I want to make is that the magisterium is a gift to us, from God, and one of the reasons is because we can get answers to very difficult questions that are brewing in the culture, okay? Some of those I'm going to talk about in the second half today, like artificial nutrition and hydration or uterine isolation. I'm going to give you, it's in the handout, but we'll come to it later. Some of these almost one word, what happens is there's a debate about something, like whether uterine isolation is allowed if a pregnant woman with a healthy reproductive system would have a heart attack later. The answer to that is no, it's not allowed. But people can't figure it out. And so people write to the magisterium, oftentimes bishops, and ask these distilled, direct questions. And the gift of the magisterium is we can get an answer, a yes or no answer to a lot of these hard questions, okay? So what I've listed there on the left-hand side are some of the most prominent magisterial documents which have answered such questions. So Humanae Vitae you've probably heard of because this is, well, you've heard of it, but this is the 50th anniversary of it, so there's a lot going on about it. And the answer to that, Catholics wanted to know, can we use artificial contraception, which by the 60s had become easily accessible and inexpensive. And the answer was no. No, okay? And then there's one on abortion, the Persona Humana is about human sexuality. There's one dedicated to declaration. Donum Vitae and Dignitas Personae. I don't know if any of you have taken a look at those. Those are the beginning of life issues. So dealing with artificial reproduction and also contraception and surrogate motherhood and all of those things. And the reason why there's one in 1987 and then relatively soon again on beginning of life issues in 2008 is because so much happened in there. New developments like frozen embryos, whether embryo adoption is legitimate or not, or certain forms of artificial reproduction. And so the church, what the church does in these documents, it doesn't only do this, but one of the things it does is list and very concisely express the question and even the medicine, and then pronounce licit, illicit, licit, illicit, licit, illicit. Now, when you read these documents, you also find very moving but short expressions, and beautiful ones, on things like the meaning of suffering, or the meaning of love, or the meaning of relationship. Like, I hope to comment on that later about one reason why in vitro fertilization is immoral is because of the relationship it sets up between the creators and the child, but I'll talk about that a little bit later. But the primary purpose is to get the answers, but you find these beautiful little statements in there about these other rich dimensions of life. And those statements are pointing to the fact that all of the no's, as John Paul says somewhere in these documents, are really a yes. to the goodness of the truth. And so, look there below the chart. There's a quote from Donum Vitae. It says, "The precise indications which are offered in the present instruction are not meant to halt the effort of reflection, but rather to give it renewed impulse." Now, if you read that, you might say, wait a minute. You just told us yes, no, yes, no, yes, no. What else is there to think about? But the document says, yes, we did, but there's more to think about. So what? A little bit later, it says there, "The Congregation for the Doctrine of the Faith addresses an invitation with confidence and encouragement to theologians, and above all to moralists, that they study more deeply and make ever more accessible to the faithful the contents of the church, of the teaching of the Church's magisterium in light of a valid anthropology in the matter of sexuality and marriage, and in the context of the necessary interdisciplinary approach. Thus, they will make it possible to understand ever more clearly the reasons for and the validity of this teaching." So the reason for further reflection is not because the yeses and nos are going to change. It's to help the faithful and anybody to understand the goodness of the truth for themselves based on a correct anthropology, so that then, like when you understand the goodness of a truth, then you sort of own it and strive more willingly to live according to it. That's what the work... So even before somebody said in the last session, I'm going to talk about this in euthanasia, both sides claim they're the compassionate ones, don't they? I'm going to save that for later, but we're going to try to locate some different opposites of compassion and see if the compassion that's claimed in euthanasia is actually an opposite of love, even though it has some elements of love. But it takes work to do that, philosophical work. And that's the further reflection that these documents call for, that we have to think deeply about the reasons for the truth. And then people, like Pope Paul VI says in Humanae Vitae, he says people of our day are capable and open to grasping the reasons. But we have to make an effort to explain them to people. Okay. So, now, part 2. I'll come back to the magisterium a bit more later, too. Part 2, just some brief things about ethics. The basic distinction between object, intention, and circumstance. So, it's from the Catechism. I have the passages there. It's from Thomas Aquinas, too, just to get a certain idea in our minds. Object in moral theology or philosophy, the moral object they have names, like abortion is a moral object, euthanasia is a moral object, almsgiving, giving food or money to a poor person is a moral object. And the moral object includes the act, what happens, and your choice to do it. That's the moral object. The intention is the reason why you do the act. So if there's a poor person there and you choose to go buy 2 lunches and give him 1, that's the moral object is almsgiving. What's your intention? If your intention is because you've seen him there a couple days and your heart is moved and you want to show him some love and get some food in his stomach, that's why you did it. But let's say you were going to walk past him and insult him. None of you would do that. I wouldn't either, I hope. And just before you do that, you see someone over there who you want to show off to. So you change your plan. Go buy 2 lunches, give him 1. The moral object was the same. What you did and what you chose to do was almsgiving. But your intention was vainglory, not love for that guy. So your whole moral act is not good in that second case, even though he got food, and even though you chose the correct moral object. So our acts can be vitiated in their goodness because of a bad intention, even if there's a good object. And you can flip that. There can be moral objects which are so bad, intrinsically evil actions, that no good intention could ever turn it into a good object to choose. Like euthanasia is going to be one of those. Even though those intentions, like to relieve suffering, is a good intention. It's just that to kill somebody to relieve suffering isn't good. Even if You're burning with a desire to relieve their suffering, which is noble. If you choose killing them, no, it's bad, no matter how good your intention is. Okay? So you can have a good intention and a bad object, a good object and a bad intention. Neither of those acts are good. Circumstances, like if a little kid steals a candy bar versus a professional thief, he should go to jail. The kid should just be yelled at and taught not to steal. Okay? But the difference in circumstance doesn't change stealing into good. So there can be degrees of culpability. Aristotle talks about that a lot. But if it's an intrinsically immoral act, it stays that way, no matter intentions or circumstances. Okay? And so there's a whole discussion of culpability, and we can talk about that, but what I really want to focus, and that's a huge important thing to talk about in pastoral care for people in difficult situations, how you sensitively deal with that. But here we're just doing philosophy. I want to get at, as much as possible, some of the metaphysical reasons about persons which make some moral objects be intrinsically evil by their very nature. So the wrongness of intrinsically evil acts is rooted in what a human person is. And so we want to talk about that more, what a human person is. Now, the Hippocratic Oath was talked about in the last lecture, and I just want to make one little point about it. It is true on the PBS website, you can see the original version, a classical ancient version, and then this, what they call on the PBS website, the modern version of the Hippocratic Oath. And it's the one written by Dr. Louis Lasagna in 1964. Now, the Hippocratic Oath has been changed over the centuries. Like the first line of the original one, the vow you made was to the god Apollo. So people don't want to make a vow to the god Apollo now, so that's okay to change, okay, that part. But I plucked out a line here from this ancient version on the left in the box. Let's just read it. I will neither give a deadly drug to anybody who asked for it, nor will I make a suggestion to this effect. Similarly, I will not give to a woman an abortive remedy. In purity and holiness, I will guard my life and my art. So, from Hippocrates until now, doctors on graduation day were vowing publicly, and they desired to, that they would never kill anybody, and they wouldn't even suggest to some poor person that they might consider killing themselves. Later on Thursday, we can explore that a little bit. What is somebody seeing, like Hippocrates, who realizes that suggesting to someone that they consider taking their own life is mean, is against the dignity of a person, is hurtful to a vulnerable person? We're going to explore that more later. Now, in 1964, that same line, this is how Lasagna changed that line on the right-hand side. If it is given to me to save a life, all thanks. But it may also be within my power to take a life. This awesome responsibility must be faced with great humbleness and awareness of my own frailty. Above all, I must not play at God. I'm glad you reacted like that. That is pathetic. But it's subtle, isn't it? He's putting, and we won't judge his heart or whatever, but that's his video, and I'm going to be in trouble. No, God bless him. But the words, the reason why I say that about it is because there's these sugar-coated words in there. The last line, I will not play at God, is a direct contradiction to the first line. Because the reason why Socrates was against suicide and all the people was because they said God is the one who has sovereignty over life and death, not us. The ancient idea expressed by Hippocrates is rooted in the idea that God has sovereignty. So for him to say, I'm going to kill some patients and I'm not going to play God, is a contradiction. is a contradiction. You could explore it out more, more philosophically. And this is a little bit funny thing to say too, but I think it's true. So on the PBS website, they have Hippocratic Oath original, Hippocratic Oath classical, Hippocratic Oath modern over Lasagna's oath. It should say Lasagna oath. It's unfair to Hippocrates to call it the modern Hippocratic Oath because it is the exact opposite. You can't get more opposite between these two quotes. Hippocrates, I will never kill anyone. Lasagna, I'm going to kill people sometime. And you call that one the Hippocratic Oath. It's unfair of PBS to do that. It's like calumny or something. Okay. So what was Hippocrates seeing? What did he see about the dignity of persons that made him see so clearly that you should never kill anybody, or even suggest to somebody that they kill themselves? All right. I decided I'm going to do one thing a little bit different this year. I'm going to read a paper to you that I wrote, and I think you'll find it interesting, and what I'm hoping it's going to do is lead us into a discussion of the metaphysics of the person. Let me just describe to you what's going to happen here. I'm going to talk about some famous autobiographies that are out there now, maybe you've read some of them, that deal with difficult medical situations. And I'm going to talk about how those autobiographies can help students grasp the body-soul question. And then at the end of the paper, I'm going to talk about a couple of recent neuroscientific discoveries. I don't know a lot about neuroscience, but I'm really getting interested in reading neuroscientists and what they think about the soul. Okay? And I have a little section in here on Socrates. All right. In my philosophy courses over the years, I've noticed that students find it difficult to conceive the body-soul question with the vividness necessary to discuss it fruitfully. Without a proper conception of the question, turning directly to philosophy texts about it can be overly challenging. Their inability, I think, is due to a combination of factors: their age, never having considered the question, and the materialistic presuppositions that are floating in our world right now. So I've recently taken to beginning my philosophy courses with best-selling autobiographies. I've used 3 such autobiographies so far. Martin Pistorius, Ghost Boy. Have any of you read that? Okay. But he suffered from locked-in syndrome for 10 years, and his autobiography is Ghost Boy. After those years, Martin regained a great deal of physical health and wrote the story of his life, which includes vivid detail of events during the time his family and caregivers thought he was unaware. That's the first book I use. When Breath Becomes Air is the autobiography of neurosurgeon, neuroscientist Paul Kalanithi, which he penned during the last year of his life. He died of cancer at age 37 in 2015, leaving behind a wife and a child. And throughout childhood and adolescence, Kalanithi's mother had her sons read great classic works of literature and a good bit of philosophy. His father was a doctor, and he chose that route for his career. Suddenly hit with terminal cancer, he decided during the last year of his life to write a book exploring whether literature or neuroscience holds the key to life's ultimate meaning. The third book, by Viktor Frankl, neurologist and psychiatrist, wrote Man's Search for Meaning. Okay, about his survival through 4 concentration camps, in which he outlines his psychotherapeutic method known as logotherapy, which represents a break with materialistic and deterministic approaches to psychotherapy. All right. Martin Pistorius is a South African man who, after a perfectly healthy childhood at age 12, gradually lapsed into what doctors, after excluding possible psychological causes and physical diseases, ended up diagnosed diagnosing as a degenerative neurological disorder. Martin gradually began losing his memory and also control over his body. He describes his gradual demise like this: "Nothing could reach me as my muscles wasted, my limbs became spastic, my hands and feet curled in on themselves like claws." End quote. He spoke his last few words about a year later and then fell into an unconscious state where he says he lay like an empty shell, unaware of anything around him. That's the beginning. After a few years in this state, he awoke on the inside and suffered in the state known as locked-in syndrome from the age of 16 until 26. He recalls, "My mind was trapped inside a useless body. My arms and legs were not mine to control. My voice was mute. I couldn't make a sign or sound to let anyone know I'd become aware again. I was invisible, the ghost boy." End quote. During this time, Martin heard, saw, and experienced many things, but no one thought he was aware. At the age of 25, one of his caregivers thought that he understood her and eventually arranged for him to go to a center where he learned to communicate via computer. He gradually regained some physical function, became proficient at communicating, though still voiceless, and eventually got married and started a business. Most of Martin's caregivers were caring and kind, while others abused him. He was fully aware of all this. Two of the chapters recount in some graphic detail the verbal, physical, and sexual abuse he endured at a care center where he stayed occasionally when his family were on vacation. In some cases, he would be tormented while others looked on and laughed. In discussing himself and the other children and adults who were too weak, silent, and defenseless to tell their secrets, he concludes, quote, "I learned that people who play out their darkest desires on us, however fleetingly, aren't always the most easily recognizable. They aren't boogeymen or women. They are ordinary, forgettable people. Maybe they are even entirely blameless until the chance to use a seemingly empty vessel encourages them to cross a line they might otherwise have never dared breach." End quote. Martin also describes how he felt God's presence very close to him throughout his life, even though his family were non-church attending Christians. His family cared for him during all of this time, and they were unaware of the abuse. And he describes the caregivers at the care center where he spent most of his time as beautiful souls. In one unsettling passage, Martin describes the time that a caregiver was pulling his hair, yelling at him, and calling him names while forcefully feeding him food that was too hot to eat. Martin vomited, and the caregiver scooped up a spoonful of his vomit and made him eat it, which he did, knowing that if he did not, she would beat him. Students are quite shocked to read about the treatment of Martin by the abusive caregivers, and this leads to two general areas of class discussion. First, students ask how some people can behave with such cruelty. The students express horror at the cruelty of some caregivers, and this leads into a discussion about human freedom and the immoral pleasure these people took in harming a vulnerable person. Rightly do we condemn the behavior of such caregivers, but pondering their actions is also an opportunity to ask about lesser types of temptations to use and disrespect others that we ourselves may fall into at times. At this point, I raise a further important dimension by asking the students, and this is important for our metaphysics discussion later, by asking the students whether it would have been okay for the caregivers to abuse Martin during the earlier time of his unconscious comatose-like state, during which he would have been unaware of such treatment. The students unanimously answer no, would not have been okay. So later in the course and later today, this point will allow us to distinguish the ontological reality of the soul from its conscious states, minimally conscious state, or completely unconscious state. The second area of discussion ensues, rooted in the fact that Martin was aware of everything that was happening to him. His inner awareness of everything and his inner suffering because of it is precisely what gives the students the feeling of horror at how he was treated. Many say that the book frightened them quite a lot because of learning that such a syndrome can occur. Imagining the contrast of a perfectly sound interior life combined with a barely functioning body in a real-life story has the effect of granting the students the ability to form a clear and vivid conception of the soul. In fact, often in their reflection papers, I have to bring them back from an overly spiritualistic conception of the human person, namely the view that the soul is so important that only it, and not the body, is the bearer of moral significance. They come to this view via their intense indignation at Martin's treatment, the horror of which, as mentioned, is manifested to them primarily via his thoughts and feelings of his interior life, of his soul. They're saddened by how deeply his feelings are hurt. For these reasons, they emphasize that his soul, the bearer of his feelings and thoughts, is the important dimension of Martin, the dimension which requires profound respect. Because our contemporary mindset tends to deny the reality of the soul, this actually is a positive step in the classroom, such a clear awareness of the soul. But I remind the students that it was precisely through his body, albeit greatly deformed, that the caregiver violated Martin, pulling his hair. That's what, okay, it was able to hurt his feelings. So we are thereby enabled to turn it to a discussion of the enduring and meaningful union of body and soul, which persons are, which is made clear by distinguishing, this is how I first start that, by distinguishing two meanings of the word shell, a term which Martin uses to refer to his own body during the time of his locked-in status. The first meaning of shell is that Martin's body did not function, and he was incapable of using his will to move his limbs. This sense of shell refers to the lack of functionality of his body, and it is a helpful use of the term to describe Martin's condition. It's how he uses the term. However, it would be taking the term shell too far, and Martin never uses it in this second false sense. If one were to interpret it to mean that there was no connection whatsoever between Martin's soul and his body, as if Martin's body was just separate from him, as separate from him as the four walls of the room he happens to be in are separate from him. To make clear that the first meaning of shell is accurate while the second is mistaken, one only has to notice that the actions which resulted in Martin's deeply hurt feelings were the pulling of his hair, the force feeding, the putting of vomit back into his mouth. All those are physical actions directed precisely at Martin's body. And the reason they violate Martin as a person is because his body is not a shell in the second sense. Throughout his whole life, Martin was and is an intimate union of body and soul. That's why the violations work. The discrepancy that his body does not function while his soul functions perfectly is precisely what elicits in the minds of the students a clear awareness of the soul. And because his debilitated body is indeed still a profound dimension of Martin as the person who he is, then the students start to see that persons with debilitated bodies are full persons, an intimate union of body and soul, just the same as those with healthy bodies, and deserve to be respected as such. Okay, I'm now going to turn to two short passages from the other two autobiographies. Both of these passages deal with cases of sadness and methods to resolve or deal with sadness. And these two passages raise, each from a different angle, the profundity of the question concerning the relation between the brain and the soul, the brain and the mind. All right. The first one is from Paul Kalanithe's book, When Breath Becomes Air. And in the first half of the book, he talks about his life before he had cancer, okay? So this is him describing a surgery he was doing. And you probably all know this, it was a revelation to me, but your brain doesn't feel pain, so he's doing the surgery, which is quite common, I think, of getting a Parkinson's tremor to calm down by putting electrodes on the subthalamic nucleus, but the patient has to be awake during it. And so they just anesthetize part of your skull, take out a hunk of it, and they can operate on the brain and talk to the patient. I placed an electrode 9 centimeters deep in the patient's brain. to treat a Parkinson's tremor. The target was the subthalamic nucleus, a tiny almond-shaped structure deep in the brain. Different parts of it subserve different functions: movement, cognition, emotion. In the operating room, we turned on the current to assess the tremor. With all our eyes on the patient's left hand, we agreed the tremor looked better. Then the patient's voice, confused, rose above our affirmative murmurs. "I feel overwhelmingly sad." "Current off," I said. "Oh, now the feeling's going away," the patient said. "Let's recheck the current and impedance, okay?" "Okay, current on." "No, everything. It just feels so sad, dark and sad." "Electrode out." We pulled the electrode out and reinserted it. This time 2 millimeters to the right. The tremor went away. The patient felt, thankfully, fine. Okay, that's the first quote. Keep that idea in your mind. The second quote comes from about sadness and its resolution, is given by neurologist psychiatrist Viktor Frankl, founder of logotherapy. This is in his book Man's Search for Meaning. And here, he wrote the book long after he was out of the camp. So what Frankl's talking about here is when he's back in practice, decades after being out of the camp in Vienna, and someone comes to visit him for counseling. Once, an elderly general practitioner consulted me because of his severe depression. He could not overcome the loss of his wife, who had died years before and whom he had loved above all else. Now, how could I help him? What should I tell him? Well, I refrained from telling him anything, but instead confronted him with the question, "What would have happened, doctor, if you had died first and your wife would have had to survive you?" "Oh," he said, "for her this would have been terrible, how she would have suffered." Whereupon I replied, "You see, doctor, such a suffering has been spared her, and it was you who have spared her this suffering. To be sure, at the price that now you have to survive and mourn her." He said no word, but shook my hand and calmly left my office. In some way, suffering ceases to be suffering at the moment it finds a meaning, such as the meaning of a sacrifice. End quote. Okay. So, you have two cases of sadness. These two accounts of sadness differ with respect to cause and resolution. With respect to cause, while both patients experience the emotion of profound sadness, the cause of the sadness in the first case is electrical impulses directed to a certain part of the brain. Whereas in the second case, the cause is knowledge of a state of affairs, namely the death of a loved one. With respect to the resolution of the sadness in the two cases, in the first case, this occurred by simply eliminating the electrical impulse to that spot on the brain. Then the sadness went away. In the second case, the resolution, though not complete, occurred according to Frankl's teaching by widening and broadening the visual field of the patient so that the whole spectrum of potential meaning becomes conscious and visible to him. End quote. So let's look further into these differences. From these two accounts, it appears that psychic states such as sadness can be caused in two distinct ways. One, by manipulating the matter of the physical brain itself. That can cause sadness. Two, by understanding some genuinely sorrowful situation. Because there are at least these two distinct ways which give rise to psychic states, it would, based on the empirical evidence, be unjustified to draw the following two conclusions. These two conclusions are not justified. One, to conclude from the findings of the field of neuroscience that all psychic states are caused exclusively by brain processes. Two, to conclude from the examples like the one described by Frankl that the brain plays no role in the occurrence of psychic states. You're not warranted to draw either of those conclusions. They're unjustified because they err in concluding more than is warranted from the evidence. Better and more modest conclusions which are justified and worthy of further explanation would be: 1. Even though psychic states are sometimes caused from the brain to the mind by manipulation of brain processes, that does happen, this fact does not ground a conclusion that all conscious experiences are so caused. 2. While some psychic states are caused by knowledge, one may not conclude either that there are no psychic states caused exclusively by brain processes, or that the brain is in no way whatsoever involved in the cases of psychic states caused by knowledge. There are numerous relations between the mind and the brain going in both directions, which require subtle analyses. It would be incorrect to say of Frankl's client that his subthalamic nucleus was the cause of his sadness. Rather, the true cause was his conscious awareness of his wife's death. And this is true even if neuroscientists would also be able to show that his subthalamic nucleus was activated in some way when he was sad. The resolution of the sadness of Kalanithi's patient was directly caused by removing the electrical impulse from her subthalamic nucleus. Frankl, on the other hand, did not suggest to the depressed general practitioner that he have an operation on his subthalamic nucleus to resolve his sadness. And though a licensed psychiatrist who uses drugs when necessary, in this case Frankl did not prescribe an antidepressant. Rather, Frankl talked with the man. He did not talk with the man's brain, he talked with the man. Through this talking, the man became consciously aware of a fact about reality that he had not heretofore noticed. He had taken the brunt of the suffering that was bound to come to either him or his wife. This new knowledge about reality then relieved the intensity of his suffering. It was, in objective fact, already the case that he was bearing the suffering that his wife would have had to bear. However, this fact had not yet occurred to him. It was not until he became explicitly cognizant of his sacrifice for her that it could make him happy, and thereby make the sadness at her absence less bearable. You can see why Frankl is not a deterministic psychologist. Okay. All right. Now, the soul and the brain. In a recent and highly interesting short post, Michael Egnor, professor of neurological surgery at Stony Brook University School of Medicine, cites the early 20th century neurosurgeon Wilder Penfield, who, quoting from Egnor, Penfield observed that spontaneous electrical charges in the brain cause involuntary sensations and movements and even emotions, but never abstract reasoning or calculations. There are no calculus seizures or moral seizures in which patients involuntarily take second derivatives or ponder mercy. End quote. That's Egnor. This pertains to the question of this paper by adding the following new point. Above we noticed that sadness can be generated in two distinct ways, irreducible to each other, by administering electrical impulse to the subthalamic nucleus or by knowing about a sorrowful state of affairs. Egner now adds that there's no part of the brain which, if manipulated, would cause the patients to solve calculus problems or to wonder about the difference in relation between justice and mercy. These functions, Egner says, quote, defy precise mapping onto brain tissue because they are not generated by tissue, as our lower brain functions are, end quote. This seems to mean that while it does happen that mere manipulation of brain tissue can cause a patient to feel deeply sad, which can then be expressed like, doctor, I feel sad, what are you doing? It can never happen that a patient during a brain operation would say, doctor, I'm suddenly performing a difficult math proof, what are you doing? No, that doesn't happen. Egner says, this is what I like about reading these neuroscientists. I don't think they're being pushed to philosophy because of their experience of doing operations. So Egner says, quote, I'm a neuroscientist and a professor of neurosurgery. The mind-brain question haunts me. Neurosurgeons alter the brain on a daily basis, and what we find doesn't fit the prevailing view that the brain runs the mind as computer hardware runs software, end quote. This then led him to look for answers in philosophy. He found help in reading St. Thomas Aquinas, who Egner notes, quote, taught that our soul's immaterial powers are only facilitated by matter, not caused by it, and the correlation is loose, end quote. Egner notes that Aquinas, who lived in the 13th century, presaged certain findings of modern neuroscience. All right. Socrates, Augustine, and Aquinas, philosophers and theologians, some of them, all of them, have developed clear and strong arguments proving the reality of the soul. I have some quotes in my handout about them that I'm not going to go over here. And I turn to those arguments in my courses after reading these autobiographies with my students. One, in the Phaedo. Socrates has a bunch of arguments for the soul in the Phaedo. And in the Phaedo, Socrates expresses frustration at Anaxagoras reverting to naming the old material causes of reality after having earlier said that mind was the cause. So the pre-Socratic philosophers, in the last talk we heard about Aristotle's four causes. The pre-Socratic philosophers basically thought that there was only one cause, matter, of everything. They weren't materialists like today, because today's materialists know what you mean by a soul or immaterial reality, and they say there's no such thing. The pre-Socratic philosophers, we should cut them a break. They were just waking up to philosophical thought, and they thought material causation was all there was. It's very interesting to watch throughout history, even in Augustine's own life. It took him a long time to even conceive of something that is real, but not physical. So Anaxagoras was the first pre-Socratic philosopher who, in this long train of them, he says mind with a capital N, nous. And Socrates was all excited. But then Anaxagoras doesn't develop it. So Socrates was frustrated at Anaxagoras for reverting to naming the old material causes of reality after having said that mind was the cause. At first, and that had delighted Socrates. So Socrates says, imagine not being able to distinguish the real cause from that without which the cause would not be able to act as a cause. It is what the majority do, like people groping in the dark. They call it a cause, thus giving it a name that does not belong to it. End quote. So Anaxagoras had come so close to grasping non-material, reason-based cause of reality, and then fails to follow his flash of insight to its proper conclusion. He immediately reverts to material elements, which are incapable of causing the realities in question. Though the material elements in some sense count as sine qua non conditions, they cannot account for reality as causes in the proper sense. This is a very important point. And I make it clear in class like this. So before reading the Phaedo, we read the Apology and the Crito. So the Apology is Socrates' trial. Crito is trying to get him to escape. And so At this point in the course, when we come to the above passage about Anaxagoras, the students are well aware that Socrates was unjustly condemned to death, and that he has decided to stay in jail and await his punishment, rather than accept the escape plan offered to him by his dear friend Crito. The students understand that Socrates' decision is based on his firm conviction that to commit injustice is worse than to suffer it. I'm not going to enumerate now Socrates' reasons that he gives to Crito for determining that to escape at this point would be to commit an act of injustice against the state. But they grasp his argument and they understand Socrates' decision. So he doesn't want it, even though he's innocent, he never wants to do anything immoral, Socrates. And because of the whole way it played out, to escape from jail would be immoral, he's convinced. So he says, I'd rather go to death than do an immoral act. So the students get that. So now the Phaedo happens on the day of his death. And the whole day he's sitting there on a cot talking to his friends about philosophy. So, with that knowledge in their minds, I asked my students to imagine that they could go back in time to Athens before they had read these dialogues, and to imagine, upon entering Socrates' jail cell and being introduced to everyone, asking the kind gentleman sitting on the cot, "But Socrates, why are you sitting in this jail cell?" How would you feel, I asked them, if Socrates responded to your question like this? "Well, my visiting friend, I'm sitting in this jail cell because I have joints such as knees and hips, which have tendons connecting them to muscles. And when the muscles pull on the tendons, it causes sitting. And that is why I'm sitting in jail," and I answered your question. They roll their eyes and laugh. They know the story, and therefore know that such an answer is not satisfactory. In fact, it is not an answer at all. Of course, the joints, tendons, and muscles are conditions without which sitting in jail could not be accomplished. But the time-traveling student did not ask about necessary conditions. He asked for a reason, for an explanation, for the real cause. And that cause is Socrates' free decision not to accept a well-planned escape, combined with his previous decisions to fulfill his vocation. At this point, I tell the students that I'm going to tell them something that will shock them, and they perk up, and I say, "Your brain does not think." And it's true, they're shocked. I ask them to consider a question they are thinking of asking me right now, any question. And then I ask them, "Do you really think that blood and synapses and squishy gray matter came up with and produced your question? Did not rather you come up with it?" They realize the oddness of saying that blood produced a question or even neurons, because they experience themselves. You experience yourself right now thinking. Does that make sense? That experience of you asking whether what I'm saying makes sense, you have an undeniable awareness of you, one unified you, thinking that. You have, by the way, no conscious experience of your brain right now, but you do have an experience of yourself thinking the question. As a unified self, your brain is about 10 trillion different things. It's not one thing. Okay. The recent striking research of neuroscientist Adrian Owen brings more clarity to this point. Owen communicates with patients in vegetative states by asking them to think about playing tennis if they want to answer yes to a specific question, and to think about walking through their home if they want to answer no to a specific question. As it turns out, a distinct section of the brain lights up in an fMRI scan for each of those thoughts. You can know by looking at the scan which one they're thinking. Owen has shown by asking such patients numerous simple questions, such as, "Is your father's name Tom?" or "Is your father's name Alexander?" that they hear, understand, think about, and answer the questions. In other words, if "Is your father's name Tom?" if the answer is no, you think about walking through your house. This means that the thinking is causing a brain process, which is then seen in the fMRI scan, not that a brain process is causing thinking. Owen concisely expresses his conclusion, quote, "The results confirm that, despite fulfilling the clinical criteria for a diagnosis of a vegetative state, the patient retained the ability to understand spoken commands and to respond to them through her brain activity, rather than through speech or movement," end quote. So the hand she would move if she could is not the source of that movement, nor is the brain that is activated when she thinks of playing tennis the source of that activation. She is. I then point out that, of course, if they would get hit on the head, they would not be able to think up a question to ask me, but that this is because they would be unconscious. Or more powerful, ask, why do you love your mother? Is it because 17 million neurons are firing in this or that quadrant of your brain? Does that explain why you love her? In addition to being very unkind and hurtful to any mother who heard such a thing, it is also no different from and just as false as saying that Socrates' knees are the reason why he's sitting in jail. There's some sense in which, of course, the brain in a healthy functioning state is a necessary condition for a human person to think of a question or to perceive the presence of her mother coming through the front door, but a healthy brain is only a necessary condition for being able to do those things, nothing more. All right, I'm going to stop the paper there, so I hope that wasn't too draining for you. Oh, you liked it? Okay. Maybe we could just have a little, are there some thoughts or questions about it? Or I could draw some conclusions. Yes? Can we find the paper online? You know what? I'm kind of excited. I submitted this to the, well, it's our competition, I guess, to the National Catholic Bioethics Quarterly, and it's coming out in August, the August issue. So no, we'll work together with it.
Did you title the paper?
What's that? Okay, so it's better then. Yeah. Okay, so I made the right choice. I made the right choice. And the title of it in the NCBQ, it's coming out in the next issue. It's going to be, I think the title is going to be "Discussing the Spiritual Soul in the Classroom." Discussing the spiritual soul in the classroom, and it's pretty much what I just read to you. There might be a few little changes, but the reason I came up with that paper, as I say in the paper, and maybe we can look at a couple of the things on the handout if I can find my copy of it, is because it is hard for people to grasp even what the soul is nowadays. Could I have one of those? I thought I had one. Thank you. Yes?
Okay, so I guess I do have some questions about what all of this you conclude is the soul. Because,
right.
like, one of the points you made earlier on is that the soul is distinct from consciousness.
Yes.
But then you were also, in describing the Dostoevsky scenario, like, referred to the soul as having, like, his feelings and thoughts.
Yes.
But then clearly he had a soul even when he didn't have feelings or thoughts.
Exactly.
So what was the soul doing then? And then, yeah, I guess that's my question.
Okay. It's a good question. And these are very deep questions. And they were all brought up. We started down this path in the morning sessions. So if you look maybe on page 2 of the handout, so on the back of page 1, it goes front back. So this, I'm going to introduce a term, the term dignity, the dignity of person. You hear that a lot in the writings of the Pope, popes. So the universe, God's creation, is full of beauty. Let's say objective value, and it's in a hierarchy. Like a lion, even a piece of paper, because it exists, has worth. It's stunning to exist. Okay? But a lion, compared to a paper, is higher in the hierarchy of being from the point of view of value than a piece of paper. and a human being is higher than an animal, and an angel is higher than us, and God is the highest, and so forth. So there's this hierarchy of being. And if you read the first line, I think, of Dignitas Personae, it talks about in there the relationship between ethics, metaphysics or ontology, and axiology. Axiology is the term for the study of value or goodness. So at the beginning of this lecture, I said that there are intrinsically immoral actions, actions which are wrong always because of reality. No matter how good your intention is, if you do that thing, you'll be violating the goodness of being. Now, so to torture an animal is an immoral action because they can feel pain. So we say animal has a higher value than a podium, which if I threw this in the fire, there's nothing wrong. I mean, there's property rights, but there's nothing. Okay, so, all right. Now, so the word dignity. I want us for this conversation, and I think it's good to do this in general, to just decide that the term dignity is going to refer only to one value, a particularly lofty value, the value of persons. So we won't say animals have dignity. We'll say they have more value than a podium, but not that they have dignity. And so there's this question, why? And people doubt this. People are saying animals are equal to people, and we have to deal. We can try. Maybe we can deal with that a little bit here, but we're denying that. We're saying persons are. There's a gap, and we have dignity and they don't, even though they have morally relevant value. And people have thought that forever. And so the question is, what is it about being a person that lets us that grounds our dignity? What is it? That would be a theological reason, and it is one reason, being a child. So what I want to say is, there are more than one reason. There's lots of reasons. We're complex, beautiful creations, and there are various sources of our dignity that distinguish us from other beings and ground absolute morally wrong ways to treat people. Okay. The answer that Aristotle first gave was rational nature. We have a rational nature, and animals don't. Like if there was a dog or a cat sitting here right now, the dog or cat's eardrums would be vibrating the whole time, but the meaning, by the way, I'll try to paint a picture of a number of the different sources. In addition to rational nature, which I'm going to talk about in a minute, but I'm going to combine it with the fact that we are a body-soul unity. That's another source of our dignity, that we're an intimate, mysterious union of body and soul. Sense perception, by the way, is one of the ways that you become aware of that, because I'm thinking thoughts right now. Thoughts aren't physical. I can take a piece of my brain out and put it on here, but I can't take a thought out with a pair of tweezers, and it's not physical. So I'm thinking immaterial thoughts, and I want to share them with you, and I have to do that by using my body, in this case by talking and making sound waves, and they hit your ears. But what's amazing, the difference between a dog and cat and us, is that this is actually miraculous. We never think about it because we do it all day. But we transcend ourselves meaningfully. Like the meaning that I'm thinking is now you're thinking it. But but the dog isn't. And so that we know, so there's a physiological side to sense perception, and there's a spiritual side to sense perception. So that shows our body-soul unity in a mysterious way. Yes?
Sorry, just to clarify. So the soul that we're talking about, as we're continuing with the mind-body question, is that the soul of Aristotle, the form of body, having is that
Okay.
Or is this like the theological
Good.
aspect of the soul?
It's a very good question, one thing that's interesting about Aristotle is that at the end of the Nicomachean Ethics, so for most of his philosophy, you are right, that he defines the soul as, you could say, nothing more than the form of the body. But in the end of the Nicomachean Ethics, he starts talking about the soul as if it transcends the body and can even live without it, which is rare, which is unlike Socrates. So I won't read to you from Aristotle. I was going to, but he does hold that view. But that's good. You want to know what I mean by the soul. Let me just read to you a line. I thought of this line because last time somebody said, what retains the unity? So you die. So death is when the soul leaves the body. That, from a theological perspective, was never supposed to happen. Death was not supposed to happen. It does happen. And Catholics and some of the Jewish people, they had the Sadducees and the Pharisees disagreed on that, think that there's going to be a resurrection of the body. So we're going to be back together. We were never supposed to be separate. That's how important. That's why we're different from Socrates and reincarnation, because we think your body, the body you're sitting on those chairs with, and that's you. No reincarnation, because your soul and your body, God made you. Okay? Now, in 1979, I came across this little quote. The Congregation for the Doctrine of the Faith had this letter on certain questions concerning eschatology. And it says this. It's one paragraph. The Church affirms that a spiritual element survives and subsists after death. An element endowed with consciousness and will, so that the human self subsists. To designate this element, the Church uses the word soul, the accepted term in the usage of Scripture and tradition. So just to conceive that, you, yourself, when your body dies and becomes a corpse, like we said before, your soul still exists with no body. And you can still think. Okay? Now that soul, now there's a debate, between the Platonists and the Augustinians and Aristotle and Thomas, whether man, but Thomas, if you look around question 75, he says that man is made of a spiritual substance and a bodily substance. So it's like we are two substances making one substance, if you will. An easy way to grasp the fact that the soul is a substance in some sense, even after death, even though we're incomplete because we're supposed to be together, is that spiritual element, the human self which subsists, it's not an accident of something else. It stands in itself, okay? Now, okay, so just conceive that. Now, that, even though I read from a church document, philosophers from ancient Greece to the present have grasped and come up with very strong arguments, very convincing, like throughout the Phaedo. I think Socrates' arguments are stronger than Simmias' arguments. That this soul is real, immaterial. Whether it's immortal is what they're debating in the Phaedo also. Socrates thinks it is immortal, and he has proofs for that too. So now, I'm going to assert some things rather than bring them to evidence. But now you can see what I mean by soul, okay? Now I mean that this soul can lose its consciousness and still exist. Okay, go.
So it's like potency. There's a potency to talk.
Yes. So, yeah. Well, okay, and actually that's something I wanted to just toss in. It came out a little bit this morning. So just to make it sort of chart-like in our minds, you could say that you have a soul, the soul, spiritual soul, and it has three, let's call them powers or faculties. One is your will, your free will. One is your intellect. And the other is your affective, with an A dimension, your feelings. So human beings, we have these three powers in our soul which allow us to meaningfully transcend ourselves to the universe. We can be moved in our emotions by love or by the beauty of a painting. If a beautiful painting was right there, a dog might walk up to it and lick it, but it's not going to be moved by its beauty. So there's this transcendence to meaning that we can do because we have a profound effect. There's a great book by Dietrich von Hildebrand called The Heart, where because the Greeks tended to over-intellectualize the rational nature of human beings, but the heart is just as important, actually. More important in many ways. Even though there's a gift character to the deep emotions, the mere fact that we just can't will them, like to be sorrowful, to be joyful, doesn't mean they're less part of being human. They're actually more. It's precisely their gift character which makes us. So let me just finish the chart and then I'll get. So we got a soul. Then we have these three powers: intellect, will, and feelings. Those are the powers that we can do individual conscious acts and experiences with. So right now you have an intellect and hearing in your soul, and you're using it to think about what I'm saying. Okay? But if you leave here and go read a novel, you'll be using it to read the novel. So, or feelings, you have the power, the potency, the power, well, no, you have the faculty of affective ability in hearing in your soul. And then when you have a deep emotion, it's actualized. Okay? Now, in order for somebody who has a soul with three powers like that, person, to be able to think about a lecture or to be moved by a beautiful work of art, there's a precondition. You have to be consciously awake. So consciousness, now think about consciousness. It comes in degrees, doesn't it? You can lose it if you go into a coma. By the way, you and me are all going to lose our consciousness tonight. We're going to go to sleep. And we're going to go into a state of dreamless sleep at some point, and there'll be no consciousness then. If someone walked in there and killed you, would it be murder at that time? So person is not identical with conscious awakeness. If it were, you'd have to say it's not murder. So there's a reality to your soul which is fully present when your consciousness is gone, if you're alive. This is why Peter Singer won't answer the question whether healthy adults in a state of dreamless sleep are persons or not. He won't answer it. He will say, if you ask him, would it be wrong to kill them at that moment if the moral calculus said it would make more people have their preferences? He'll say no to that. And then you say, why? And he says, this is bizarre, but he says, because, preference for thwarting preferences. That's what's immoral to modern utilitarians, thwarting preferences. So he says, well, if you go to sleep, he even writes about this in one of his books. If you go to sleep, before you go to sleep, you have a preference. Like, before you go to sleep tonight, you have a preference to go to the next talks tomorrow. And then when you wake up the next morning, you remember your preference. So he says, if you kill the person in the middle, you'll be thwarting that preference. And thwarting preferences is a very bad thing to do. That's his answer. But so he gives an answer. He gives an answer which is consistent with his utilitarian philosophy, and allows him to give a moral account for why he's against killing healthy adults in dreamless sleep. But that answer is an evasion, because we want to know whether he thinks that's a person then. But if he says yes, then he's going to have to admit that if there's one case where a completely unconscious human is a person, why not the other cases of unconscious humans? He won't be able to answer that. That, I think, is why he gives that, because he doesn't want to say you can go around killing people in their sleep. Although it's sort of, he's getting closer to that because the age limit for, like we heard this morning, is going up. In other words, there's this thing now, post-birth abortion is a thing now. But it's based on the idea that we heard this. So, and here's another little point I just want to make. Some of the people on our side, the pro-life side, speak disparagingly about personhood theory. Well, that's Peter Singer, personhood theory. But we shouldn't let them have the word person, because the Trinity is three persons. I mean, person is the highest point of being, person. Like the being qua being, metaphysics. What is being qua being? The best answer to that is person. Divine person is the highest. Not just substance. Substance, Aristotle said. Esse, Thomas said. But the deepest, Wojtyła would probably say, person is the heart of being. Person is the heart of being. So, which we heard this. So the personhood theorists that we criticize, those are the people who reduce personhood to mature conscious awakenedness. Whoever doesn't have mature conscious awakenedness, they say, doesn't count as a person. Here's my theory about, it's only one theory about why this happened. Early on in the abortion debates, people used to say the embryo is a clump of cells, or it's tissue, or sometimes even it's not even human. Occasionally you still hear that. But the findings of microbiology, genetics, embryology, sonograms, but even embryology at the microscopic level shows that from the moment of, I would say, even fertilization, as soon as the egg closes before the haploid chromosome parts come together, you have a distinct living, growing member of the human species, distinct from its mother. Singer admits that. He says they're all human. You can't, if you want to debate with scientists, you can't deny that anymore. But they still wanted to be able to kill them. That's why they made a distinction between two groups of humans who are living and growing. One group of humans are people, two, and the other group of living, growing humans are not people. Those ones you can kill without doing anything wrong. They're not persons. Why? Because they don't have mature consciousness. Because they reduce personhood to mature consciousness. So that's the whole... So all your questions about the soul, the thing I'm trying to get across is that personhood is deeper than consciousness. It's like an inviolable, inalienable ontological reality. Look at page 2 again there. If you see part 2, it says types of sources of personal dignity. Letter B says alienable and inalienable. Alienable and inalienable. If you think about consciousness, it's amazing. It's a stunning reality. The ability to be conscious and to actually be conscious gives us worth, makes us higher than a paperclip, which can't be consciousness is one of the things in the hierarchy of being which is very high. But you can lose it. You can have it in degrees. The difference between us and that argument is they say if you lose your consciousness to that degree, you lose your worth and your personhood. We say if you lose your consciousness, you're still a person with the full dignity of a person because your soul and body are still there. This came up this morning too. Another, different from consciousness, but related to it, alienable. This is striking. Alienable, an inalienable source of worth, a definition of these two terms maybe. An inalienable source of dignity is a source of dignity that we all have equally and you can't lose it. Inalienable. Alienable sources of worth are things that make us higher than other beings that aren't human persons, but you can lose them and they come in degrees. So consciousness you can lose and it comes in degrees, but that doesn't mean you're worth more than someone with some cognitive disability. In fact, I think a lot of times sometimes I think having high intellectual abilities lowers your worth because you find these people who are sometimes so deeply happy with severe impairments, and you're almost envious of their happiness and their love inside them. So I'm not saying that, well, hopefully you can see that the most important things in the soul of a person don't depend on IQ. And it can be dangerous, actually. But now, one more little thing, though. The moral, think about the moral life. So this came up this morning. So virtues and vices. Virtues and vices. And this can relate to the question about substantial change that was touched on. This is a very mysterious question. You can grow in virtue, diminish in virtue. You can get more vicious, become less vicious. That's what we heard about this morning. You have to work at that. You have to have role models. You have to practice good habits. We need grace. If you compare someone like Mother Teresa of Calcutta to Adolf Hitler, think about them. From the ontological point of view, they're both persons. From the ontological point of view, they have equal dignity. But from the moral point of view, they don't. And one very difficult philosophical and theological question is, which of those two are ultimately more important? Your moral becoming, which is alienable, or just being a person, which is inalienable? And that question is sort of hard to answer, and when you start to think about it, you become very grateful for God's mercy. So if you think about Jesus' comment about Judas, that it would be better for him if he had never been born. I'm not a scripture scholar, but what does that mean? Does that mean that even though Judas is an ontological person with the inalienable dignity of a body-soul unity, and by the way, one thing I didn't talk about yet is the utter uniqueness of each person. That's maybe the deepest source of dignity. So like your uniqueness, like you have a rational nature, rational nature, rational nature, rational nature, and so on, body, soul, body, soul, body, soul. There's a, like we heard this morning, human nature is something you can talk about, but it gets instantiated more than once. But you cannot be instantiated more than once. It's impossible. You are unrepeatable. The source of love is catching a glimpse of the unique unrepeatability of another person. That's what inspires love. When you make a new friend or fall in love, you don't run home and say, guess what? I met another functioning intellect. You say, I met a person. this person was expressed to me through a rational nature, but there's a core of you which, like, your mother knows best who you are, somebody like that. Like even Hitler's mother. She remembers little Adolf. She actually has the true vision of him more than we do, because she remembers that unique little boy. We see all the evil, moral vices, which are, like one philosopher said, smudges on the surface of a diamond. But then, so in that sense, it seems like the ontological outweighs the moral. But if hell is real, maybe the moral outweighs the ontological. It's all, I mean, to put it sort of colloquially, like, what good is your ontology if you're in hell forever? So it's actually hard to figure out. And so this question, one deep question about substantial change is, so like the smoothness of the podium doesn't know it's smooth. It's a very superficial way to inhere in something. But your thoughts, your hair color inheres in you like the smoothness. But your thoughts don't inhere in you like the smoothness. You are the source of your thoughts. You live, the podium does not live its squareness, but you live your thoughts. You live them. And as we heard Wojtyła, he said every time you do an action, you become yourself and you reveal yourself. So to what extent does the ontological reality of a human soul change when they become holy or when they become vicious? I mean, you are still a person, so you don't turn into a tree or something. But the moral life, even though it's alienable, seems to be the meaning of our ontological being. Like if you fail in the moral life, you fail at what it means to be a person. Which is why we need God's mercy too, to make us feel better when I just said that. But you have to take that seriously, that even though the moral part of us is alienable, it's hard to figure out if the ontology or the morality is more important. There may be both important in different senses. Because one of the things philosophers do is they distinguish in their minds things which in reality are together. We do this just to see, but in reality it's your one body-soul union with your ontology and your morality all together. But all right, did you still have your?
Well, I was just going to say that at least where I'm at right now in terms of understanding what the soul does is I hope this isn't radical enough, but it doesn't seem like the powers of the soul really, like, it seems like the body is perhaps a necessary condition for the powers of the soul to be actualized. And maybe that's okay, and maybe that doesn't diminish the value of the soul, but like actually elevates the value of the resurrection.
I'm going to answer this question, and then we can take our 15-minute break a little early, because for this half we have like an hour and 45 minutes, and for the next half we only have an hour and 15 minutes. I'm going to make them equal. But the paper that I read to you, one of the points I wanted to make there was, and this is a little bit too simplistic, like at the end of the published version, I call for philosophers and neuroscientists to work together more. Like, there's a big fat book called The Self and Its Brain by Sir John Eccles and Karl Popper. One's a philosopher, one's a neuroscientist. It came out in the 1970s. It's a very good book. But I don't think it goes far enough. But it's it's a model. That book is a model, The Self and Its Brain, for neuroscientists. And but so the simple point, or one of the simple points I was trying to make in the paper about that question is that I think it's more appropriate, and Socrates does too, to think of the body as a condition, but not a cause. So if you mean necessary, by necessary, a necessary condition, then I'm happy to agree with you. But if you take it further and say that neurons fully explain the conversation you and I are having right now, I would disagree with you. Because that would mean that we shouldn't talk to, if you want me to agree with you, you should do surgery and make my brain look like your brain. That would be saying that the brain is the cause of what I think. Strict determinism means there's no knowledge or freedom. You couldn't even know your theory was true if... And I said that's simplistic, but that insight is the necessary start. It's the starting point, and then there's all sorts of very subtle relationships between the brain and the soul, and maybe we can talk about a few more of those after. But yeah, let's take a 15-minute break now, and then we come back. Okay, good. All right.